Hi, my name is Dr. Conley, and this is Dr. Perez. So first, this is one of the best tools I think we have in our clinic as far as assisting on assessing our patients for foot pathomechanics. So what we wanted to do was put together a little video for you guys on how to use this. These functional foot maps, if you purchased one of these booklets comes with it. This is a really good tool for you to look through and to really go through and study. It talks about dysfunctional footprints and proper shoe sizes. It will show you some of the footprints that you're going to see. We are in the process of designing a mini course on the different footprints, so we'll get that out as soon as possible, but at least you guys can get your feet wet and starting to use this stuff. If you had purchased a blue one, we're going to make a copy of this for you and send it to you so you'll be all set. So this is a foot map. Basically what it's going to come with is ink. This is going to be the roller. This is going to be your pedograph or your foot map paper. Once you run out of this, you can also use legal size paper. They sell it like Office Max. And then this is the foot map here. On the inside of this, okay, there will be instructions on how to use it. This is the actual grid. On the inside where you see the squares, that's going to be where you put your ink, because that's going to be what puts the print onto the paper. And then you're going to flip it over, and then the patient's going to step onto it. So we're going to demo this for you guys. I have been doing this for 10 years, and I just started wearing gloves because I've been getting ink all over my hands. So do what you will, but it helps. So the first thing you're going to want to do is open up this map. And then I'll take the ink. You don't have to go heavy here. And I'll just kind of make like little squiggly patterns across the grid there. All right, and then with these, you just take your roller, and then you want to make sure that that ink gets all over the map. Okay, get all into the corners here, and I'll just roll it a couple times. Okay, the first couple prints you might have to put a little more ink on it, but once you have ink on there, you don't need to go heavy. Okay, but after each print I do, I'll go ahead and take the roller and just clean it up, almost like you're erasing a chalkboard, so you can get a fresh print on it. Okay, so from there, I'm going to take a piece of paper, and I'm going to flip this here, and then you just flip the grid over the paper. In the blue pedographs, it's the same concept. You're just flipping it over onto the other side of the grid, or graph, okay? So when we do these, what I'll have the patient do is, if I'm going to be doing her right foot, I'll have her stand pretty close to the pedograph. Sometimes when they're stepping far away and they try to walk and do it, they're going to skid the print a little bit. So I'll have them stand here, arms at their side, and then I'm going to have her take her right foot, place it right on the map, and then walk right through it. So step and walk. Try not to have anything in their field, okay? If you have something there, the patient's going to try to move around it, and it's going to affect the map, okay? So then what we'll do is take this out, okay, and then you have an awesome footprint, okay? I'm going to come up here. So what you're looking for here is the increased ink, okay? So on Jen, you can see that there's increased ink underneath the second and third metatarsal heads. That's not ideal, Dr. Perez, okay? We want to see ink underneath the big toe. The big toe is 60% bigger than the other toes for a reason. That's the one we toe off of, okay? The other thing you can see on here is the increased toe grip underneath the second and third mets, which means when she's walking, she's trying to stabilize with 2 and 3. That again is not ideal, okay? The other thing I will do with this is I'm also going to do 2 prints, okay? I want to make sure that she didn't screw it up, okay? Or I.
To put it gently.
Or I didn't screw it up, okay? So then I'm going to take my roller again, and I'm going to roll through here. And then I'm going to take another piece of paper. And then I'm going to do that right foot again, okay? Okay, And then you just want to compare the two prints. Do they look similar? Do the ink impressions look the same? And if they do, you're good to go, okay? Usually I'll keep one of these for the file. I give one to the patient. She can hang it on her refrigerator. In 2 to 3 months after we're done treating her, then we reprint, and you'll be able to start to see change in the mechanics of the foot. It's really cool. And then of course we'll do the same thing on the left side. Anything else you want to add here?
Nope. I would say that this is a really good tool also for patient education. So a lot of times, even if I feel like I already have an idea of what's going on, I'll still go through the pedograph, because visually it's easier for the patient to understand what you're talking about with the foot than it is when you're just explaining it to them.
Yeah, I mean, your patients with a Morton's neuroma, for example, okay, when they're like, I have pain underneath my second and third metatarsal heads, you know, once you print them, you can be like, oh, they'll be like, oh, that's where I have pain. So it's a very good visual for them to really understand the mechanics too. So again, patient education, I think that's a huge point. And that is our goal, really, is to educate the patient.